How old are you?
79.
79. And we did a scoliosis surgery, minimal invasive OLLIF transcambient scoliosis surgery, just about when?
We did it August 14th.
August 14th, so about 5 months ago.
Yeah.
How was your life before that? Tell me about
Oh.
your limitation on life before the surgery.
It wasn't that I couldn't do some things, but it was tough.
Tough, yeah.
Really hard. If I was going to make dinner, by the time we got to eating and I cleaned up the kitchen, it was more than I wanted to do again.
1 to 10, how bad was the pain?
7, 8.
7, 8, every day?
Just about every day.
For how long? For how many years?
Definitely 4.
Definitely 4.
Mhm.
Okay. Could you continue living like that?
No, I wouldn't want to. That
You
was
didn't want
really
to.
tough.
Yeah, it was tough. Now, and we did all the other thing, and you weren't really improving with other means and so
Yeah.
on.
Yeah.
And but finally, we decided we want to go and fix your scoliosis because you had a scoliosis. And I'm going to turn around. This is your picture from the surgery that we did. We did the surgery 5 months ago, and the bone inside here is growing.
That's good.
Yeah, and as well, bone. I'm able to see that the bone in the back as well, in the facet we call, is growing. And we are going to go up and look at the films here. The screws are good. Bone is growing. In yours, sometimes we try to get the screws from both sides of the bone, so to make them stronger. And overall, I'm very happy. And we just measured your cob angle or the scoliosis. It is now about 3 or 2 degrees, where it used to be more than 20, actually.
That's amazing.
Yeah. How long did you stay in the hospital?
Just overnight.
So we did a 3-level fusion, scoliosis correction, and you stayed only over the night in the
Right.
hospital.
Yeah.
And as you know, you have other problem in other levels.
Yeah.
And we decided though not to fix it all. We
Yes.
decided to fix only those levels on the bottom that are giving your symptoms to you. Do you remember the conversation why we decided to do that way?
Why I decided to go ahead with the surgery, you mean?
No, well, that as well, but as well, why did we not fix it all?
Okay, because it was just too big of a surgery at that time.
Yeah, and especially, for your age group,
For
too much
79.
surgery
Yeah.
is going to be much more riskier, too much resource on your body. But we fixed only the bottom 3 in a surgery that I have the record of the surgery here, that you stayed just over the night. The surgery was 66 minutes, and the blood loss was 130 cc. And I remember as well after the surgery, you had some nerve irritation in the leg.
A little bit.
Yeah, is that gone now?
Yeah, it's all gone.
So how is your pain now these days?
I wouldn't even say it's pain. It's more discomfort right now with probably a 2.
Okay.
And it's
Yeah.
certainly can be lived with at this point.
Yeah, so overall you're happy with the result?
Oh, I'd do it again in a heartbeat.
Okay, well, but as well we talked about that that the bone is still going to heal and it's going to get better in the next 6 months. And you asked me a question. What question did you ask me?
Can I ride my lawnmower?
Yeah, you see, you're 5 months after the scoliosis surgery, and you're asking me, when can you go and live your life again?
Yeah.
I think you're getting ready. That we are going to get, obviously it's winter, so there's no need for lawnmower
No.
at this point. But I think you will be ready when the next time there's a need for lawn mowing. I think you will be ready.
Great.
And now, nevertheless, this is the power of this minimal invasive surgery that caused minimal damage to get the job done. You wouldn't be asking that question today with the open old-fashioned surgery.
No, I wouldn't.
Yeah.
No.
Now, overall, any other comment? Any other thing you want to
No,
ask
I
me?
just, it's amazing from the way I was feeling to the way I'm feeling now.
Mm-hmm.
It's wonderful.
So, actually, I'm talking to somebody who says that he needs a surgery, but he's afraid of open surgery for a good reason.
I have a friend that had some spine surgery maybe 2 or 3 years ago, and he definitely needs to do something now, and he just won't. He's scared of it.
Yes.
I've tried to encourage him because there's nothing to be scared
Why
of.
is he scared of?
I don't know if he thinks he's got to go through a series of injections, which he did try to do that once, and it hurt him so bad,
Yeah,
he just said, I gotta get off this table.
Many of my patients are telling me if they had a previous spine surgery, they say it was so traumatic, it was so painful, and the recovery was so long, and that is why they are scared of
Probably,
the surgery.
yeah.
But in your experience, you stayed with just one night in the hospital. How long after the surgery were you able to do your basic daily activities? Do
Well,
basic things.
I mean, I didn't do any lifting or any pushing or pulling or reaching too much for a few months, but it didn't stop me from walking, and it didn't stop me from doing a few things,
So when could you cook for yourself?
Oh yeah, when?
How long after the surgery?
Well, probably a month.
A month?
Our kids were so good, they kept bringing us food.
So would you wait another 4 years to go through this?
No. If I had to do it, I would do it right now.
Okay, thank you so much. I really appreciate that.